Thank you very much. I'm very pleased to join my distinguished colleagues and partners for today's press conference. The question we are facing is, when will we ever learn? It appears that we have learned nothing from COVID and are leaving the world as vulnerable as it was before. This new treaty, as it is currently written, fails on all of the basics: transparency, accountability, and most of all, equity. Its core principle is extreme greed and selfishness perpetuated by the rich countries who are protecting multinational drug companies at the expense of the rest of the world. The draft treaty smacks of colonialism. The developing world is supposed to send their natural resources, in this case pathogens, and the colonialists will return the favor by selling them the finished goods, vaccines and medicines, at prices they cannot afford if they can get them at all. Unfortunately, the wealthiest countries in Europe are leading the charge with the support of the United States. Fortress Europe is a crazy notion. It didn't work for COVID, and it won't work against the next pathogen. Compromise would be acceptable if what was being offered was half a loaf of bread. But this treaty is not even a single slice. It is crumbs. Simply, the position of the wealthy nations is a dangerous disgrace that must be rejected. I mean, I think that when we get the agreement we need, we should build upon that. First of all, I mean, we have current threats that are not being addressed properly. We have dengue fever. We have, in the case of TB, we still have, a great lag there in terms of availability of the best medications and in terms of diagnosis and the like. Another thing we have to attack is we have to attack the definition of a middle-income country. One of our campaigns has been, that the cost of a fancy cup of coffee, it costs more than what is considered the daily amount of money to make you a middle-income country. The idea that a little over $1,000 US dollars represents middle income, is ridiculous. And even though the World Bank says that it doesn't, if that doesn't apply to the cost of medications, every drug company determines that if they will charge more to these so-called middle-income countries. And then on top of that, funding agencies like the Global Fund start to defund the countries, and puts a tremendous burden on these countries that they cannot meet. I mean, ultimately, goal is to raise global public health into the pantheon of issues that the world needs to address, such as poverty, such as climate, such as equality for women, et cetera. And public health always seems to get the short end of the stick. The conventional idea that an ounce of prevention is worth a pound of cure seems to go out the window as soon as we get over one of these outbreaks. And I think we can light the way, and that's the bottom line. Is that I think back in terms of our experience when we said that when we introduced the idea of test and treat, that we had to fight to get from 200 T cells to 350 to 500 to universal access, right? And it seemed like an impossible task, but we did it. And very often, I look back at history, I think about a session such as this, where we were putting out ideas and having our voice be heard, and it multiplied, right? A lot of people spoke about the fact that people are not briefed on these things and they don't understand that decisions are being made that are going to affect their lives in the future. And that's our responsibility to alert them to what's going on and to give them an opportunity to channel their opinions and their voices. And I think that's what we've done today. I mean, it's so gratifying to look at the screen and see the dedication and commitment of all the people who are here tonight. I mean, Daniel talked about a wake-up call. It's now 2 a.m. in Los Angeles. So this teleconference has been my wake-up call So, thank you. Just thank you very much for participating from all over the world. And, I wish us good luck in making this happen.